afternoon, everyone. I hope everyone had a wonderful weekend. I am Taylor Myers.
And I'm Terrence Lindsay, and this is our first episode in April, which is also graduation month. Taylor, how did you feel about graduating this month?
Honestly, it hasn't really sunk in yet. I still feel like I could be at the beginning of this. So I'm definitely excited to be towards the end of it. But this last month, a lot's got to come together. So hopefully it all goes well and we can get out of here quickly and move on to bigger and better things.
Yes, exciting times. On this week's episode, we're going to talk about NCLEX license exam and life after graduation of the College of Nursing.
To help us out today, please welcome Lexi Ruhlman, who graduated from the BSN program last spring.
Hey guys, I'm Lexi. I graduated in May 2020 last year. I am a registered nurse at Sparrow in Lansing, and I work on 7 Foster, which is a respiratory step-down unit.
Yes, thanks for having you today. It's such a pleasure. Can you tell our viewers a little bit more about the NCLEX and why is it important? How did you prepare for it?
So the NCLEX is a national exam. It's the same in every state. It's really important because it's what declares you as being a safe nurse, and that you are able to perform nursing duties in a safe way. It's all about safety. The way I prepared for the NCLEX is I use UWorld. A lot of people use UWorld in my cohort. Some people use Kaplan. Not many people use ATI. I know they really push for that in the College of Nursing at MSU. I didn't find ATI helpful, but I loved UWorld. So UWorld has, the one that I did was 2,000 questions. I know it sounds a lot. And I did 60 questions a day. I sat down and took the 60 questions as I would take the exam, and I took it at 8:30 every morning because that's the time that I would take my actual exam.
As far as scheduling for the NCLEX, how long should you wait after graduation to how much time did you take to study before you took it, I guess is my question.
So I know some people took it by Memorial Day. I gave myself a week or 2 off after graduation because my birthday's May 13th. So I studied after my birthday. I really hammered down, and I took it June 16th. So I gave myself a good 4 solid weeks, 7 days a week studying. I studied on weekends. I studied on Memorial Day. I studied every day. I would do my questions in the morning, take a couple-hour break, and then go back through each and every question and look at even if I got it right, I'd want to know why I got it right, why I got it wrong. And with UWorld, there's descriptions on why each answer is right or wrong. So it really breaks down each question, and it gives you hints on, a lot of psych questions are mostly safety issues. So it kind of narrows it down, how to answer each type of question.
Yes, thank you for the advice with the NCLEX Prep. It's well needed, and I'm quite sure a lot of people will use that advice moving forward. I'm kind of going to shift gears here with the question. I want to ask more about, we know how when you graduate, the anxiety that we have finding a new job and all of the new things that come with it. Can you tell us about what it's like to be a new nurse, a new grad nurse, and also the challenge you have faced, especially working on 7 South with respiratory and with COVID? Don't know if you had COVID patients, but can you tell us a little about more of the challenge that you faced?
Yeah, so being a new grad, it's very intimidating. I'm not going to lie, because nursing school is very different from the real world. But it is super exciting being on the floor and having that independence, and just you need to have the confidence saying, I passed the NCLEX, I'm deemed safe to pass medications and do an assessment. So the biggest thing that I was taught in orientation was, if you can pass med safety and do a good assessment and check on your patient, you will be okay. So I know it is really intimidating and it's a whole new world, but you do have the resources. You can ask your charge nurse, you can ask nursing supervisor for questions, ask your nurse manager, go to other units. We have chest tubes that come to our unit sometimes, and we're not very familiar with chest tubes. So we call another unit, asking them for questions. Hey, like, what should I have at the bedside? Like, can you come and check this out? I'm not really sure. And they do the same with us about respiratory problems. There's always resources. You're never alone. You can always ask other people for help.
I know you said like most people probably start off on night shift. Can you talk a little bit how it was like adjusting to night shift and how that's like gone for you?
So yeah, because nursing school, you're up really early for clinicals. And when you're up for clinicals is when I'm just ending my shift now. So it was really tough in the beginning trying to find a good sleep schedule. And my sleep schedule is still whack. Like I sleep all the time. I'm always tired. But when you're on nights, my unit, I feel like we're always moving around and you don't get tired. And then when you come home, you're exhausted and you just crash. So it's not like trying to stay up at night is hard. It's just kind of like you kind of get like night shift nurse brain and you kind of get groggy or you kind of get a little confused or difficulty concentrating at sometimes or you make silly mistakes. But yeah, it's just, that's why you have other people for it. Like, okay, I don't remember what I'm doing here. Can somebody like help me out? Like, I'm just so tired. But for the most part, you have that adrenaline rush that gets you through the night.
Yes, thank you for that as well. I'm gonna ask more questions like how was the job search after you graduated and why did you choose Spartan particularly?
So honestly, I didn't do a ton of like job like research or apply to many places. Sparrow came. I don't know if you guys are having it this year, kind of like a nursing career fair. We had it last year. Like Sparrow was there, Beaumont was there, McLaren. So all these big hospitals came when you kind of talk about the NCLEX. I don't know if you guys are having it at all, but they came. I brought my resume. Everybody brought their resumes with them. And I gave my resume to Sparrow. I'm like, hey, can you just kind of look at this, see what I should add, see what I should take away? And they were like, this looks great. And they offered me an interview on the spot. So you really never know when you're going to come in with these connections. And they offered a lot of us interviews. And I was like, whoa, I wasn't expecting this. Like, I wasn't even thinking about Sparrow in the first place. But then they were talking about their nurse residency program. And it is honestly really great.
Thank you so much, Lexi, for coming on. I know a lot of your information is very pertinent to me and my cohort. So thank you so much. And I appreciate all of your advice.
Yeah, of course. It was great answering your questions. I've been in your guys' positions. I know how it is being a new grad and the stress and the anxiety and the excitement. But you guys are great. You guys got a great education from MSU. They really do prepare you well for the real world.
And if you want to learn more about how to prepare for the NCLEX lectures exam, click on the link below and watch Dean Raj and Assistant Professor Patrick Crane to discuss the best practice to prepare for the exam.
Also, as we mentioned earlier, it's graduation month. On April 30th, outside of Erickson Hall, the MSU College of Nursing will be having its first ever outdoor graduation ceremony. Learn more about the graduation ceremony by clicking on the link below.
Interested in learning about nurse anesthesia program? On April 15th at 2 p.m., the program will be hosting a virtual interactions webinar. You can register by going to the link below or the College of Nursing website and click on events.
As always, thank you everyone for watching. I'm Taylor Myers.
And I'm Terrence Lindsay, and I hope you all have a great week.